Hi, Paul Becker here from dismantlingibs.com, and in this video I'm going to answer the question, what are the symptoms of irritable bowel syndrome, or IBS? Now keep in mind, I can't diagnose you. This video isn't meant to diagnose you, but any doctor or healthcare provider can use the criteria I'm about to give you to diagnose IBS. The problem with IBS is that there's no biological marker. In other words, you can't just take a blood test or an x-ray and spot something that's out of the ordinary and say, aha, he's got IBS. It just doesn't work that way. It's symptom-based criteria that up until recently hasn't really been standardized. Doctors would run through all their tests and they would not find anything functionally wrong, and they'd say, well, it must be IBS. So some experts kind of saw the problem with this, and they got together with the Rome Foundation, and they put their heads together and they came up with a standardized symptom-based diagnostic set of criteria. So these are what I consider to be the most thorough. Now it has been evolving. We're now up to the Rome 3 diagnostic criteria, which came out in May of 2006. So I'm going to give you the most recent version. There's other ones floating around out there. I talk about this evolution of diagnosing IBS in my book, The 5 Absolute Most Important Steps You Should Take Now to Reverse IBS. But suffice it to say, we're still learning about irritable bowel syndrome, and consequently the diagnostic criteria are going to evolve too as we learn about it. So we're up to the Rome 3. I'm going to give you the Rome 3 diagnostic criteria right now. Most important component is that there's pain or discomfort at least 3 days per month in the last 3 months, 3 consecutive months, associated with 2 or more of the following conditions. So I'm going to give you 3 more conditions, but the focal point, the symptom that has to be there, is the pain or the discomfort. All right, so one of these other conditions that are associated with it are improvement with defecation. In other words, that pain or discomfort is improved with defecation. It used to be relieved with defecation. Now they changed it to say improved. Maybe the pain doesn't go away entirely, but it is improved with defecation. So that's condition 1. Condition number 2. The onset of this pain or discomfort was associated with a change in the frequency of the stool. So let's say this pain or discomfort started, and at the same time you used to have 3 poos per day. Now you have 10 poos per day. That is a change in the frequency of the stool. Or let's say at the same time that this pain or discomfort started, you used to have 3 poos per day, but now you have 3 poos per week. They slowed down. Again, that's a change in the frequency of the stool. So that's 2. Those 2, improvement with defecation and change in the frequency, if those 2 are present with that pain, that qualifies for IBS. There's a third one. The onset of this pain or discomfort was accompanied by a change in the form of the stool. So let's say your stools used to be like peanut butter. That is a healthy form for a stool. But now they're watery and they just come out and it's like diarrhea. That is a change in the form of the stool. Or it could be hard, solid like rocks, or clumps, little balls. Okay? That is a change in the form of the stool. It can go either way. So you see it's kind of squirrely. There's all kinds of different directions that this can go. Nevertheless, you only need 2 out of those 3 conditions to be accompanied with the pain or discomfort. Now, along with this comes these subtypes, and this is kind of a carryover from the Rome 2 diagnostic. They're still here, but they have been called into question in the Rome 3 diagnostic, but they're still present. And they are the subtype IBS-D for diarrhea predominant IBS, IBS-C for constipation predominant IBS. It used to be called, the other one used to be called IBS-A for alternating. That was the Rome 2. Well, in Rome 3 they changed it, and now it's IBS-M for mixed. So they also added a fourth one called IBS-U for unsubtyped. In other words, you don't have to have constipation or diarrhea. You can just have this pain that's relieved with defecation and a change in the frequency of the stool. You have it 10 times per day and it hurts, but it's relieved. Okay? Doesn't have to be diarrhea. So the Rome 3 diagnostic called into question these subtypes. They say, look, these subtypes, they're not very consistent. People move around between them. You know, they don't really seem to be helping us that much in pinning this thing down. Nevertheless, they're still here. So they've got these, but they just called them into question and say, look, we're not even sure these subtypes are really helping us. Nevertheless, that's where we stand. We still now have 4 subtypes of IBS. So these are what I consider to be the most thorough and up-to-date and respected criteria for IBS. But there's lots of things that can cause these symptoms, and that is way more important than the diagnosis of IBS. Now, I talk about some of these things, the most dangerous ones at least, in my book, The 5 Absolute Most Important Things, Most Important Steps You Should Take Now to Reverse IBS. You can get this ebook for free if you go to dismantlingibs.com and enter your email. I will email this ebook to you immediately. It's a very useful ebook. But you can also check out my video entitled, What Dangerous Conditions Mimic the Symptoms of IBS. You can also find it out there. Very important to rule out these dangerous conditions. Well, that's it. This is Paul Becker from dismantlingibs.com saying, I'll see you next time.